Welcome back. Louisiana is one of the leading states when it comes to GYN cancer, and since September is the month to bring awareness to the disease, Dr. Gabrielle Hawkins with Women's Hospital is here to share information, tips, and ways you can early detect or go get tested for early detection. Good morning.
Good morning.
So thank you so much for joining me. So GYN cancer, what is the official name
Of GYN cancer. So it's Gynecologic Cancer Awareness Month, and so we are trying to bring awareness to the 5 cancers that we primarily take care of. And so those are cancers that start in the uterus or the endometrium, the ovary, the cervix, the vulva, and the vagina.
So what are some symptoms or something that says, hey, you know, and of course you guys always encourage yearly exams, but what is something that says in between, you know, something may not be right, I need to go get checked out?
Absolutely, absolutely. So the things we think about is a lot of times the symptoms for GYN cancers are kind of vague, and so we usually remind patients if you have persistent abdominal pain, abdominal bloating, pelvic pain, pelvic pressure, change in your bladder function, your bowel function, any abnormal uterine bleeding should be evaluated. So anyone who has not gone through menopause, making sure they're paying attention to heavy periods, bleeding after intercourse, bleeding between periods, and then certainly any bleeding after menopause is always abnormal and should be evaluated.
That's definitely to point out, because a lot of times we do kind of focus on the before menopause. There are, you know, women who are pregnant and things like that. So I'm glad that you pointed that and highlighted that out as well. Out of the 5 types that you guys focus on, what's the most common, and about what age do you guys typically see that increase usually? Is it the younger women, the middle age, or the older women?
Yeah, so great question. So in general, endometrial cancer or uterine cancer is the most common cancer in the U.S. It's also the most common cancer that we take care of. However, in Louisiana, cervical cancer death rates are much higher. So we do want to highlight that. And that typically does occur in women who are slightly younger. So they're going to be closer to that perimenopause age when we start to think about kind of changes in bleeding and changes like that. And so we do really encourage patients to get their regular routine screening and also follow up if they have any abnormal bleeding.
Now, what are some of those contributing factors? I know you said Louisiana is one of those leading states. So is it environmental? Is it, you know, obviously what you're putting in your body? Like, what is that makes the difference for us here?
Yeah, so it's really hard. A lot of times it's going to be multifactorial. It's going to be lots of things contributing to a cancer diagnosis. For cervical cancer in particular, we know that the HPV virus causes the vast majority of cervical cancers. And so we really highlight pap smears because it is really the only screening test that we have for GYN cancers. And so the pap test also checks the cells, but it also checks the HPV virus. And so making sure that we test for that and also trying to prevent by encouraging vaccination against the HPV virus.
Now, you just kind of answered my next question, which was the importance of pap smears and other pelvic exams. Now, are there any contraceptions that kind of help with these sorts of things, like when it comes to prevention or treatment?
Yeah. So particularly for contraception, we do think about a decreased risk of ovarian cancer. So that's not one we've talked about quite yet. And so that is one thing. Birth control pills can decrease the risk of ovarian cancer. And then for cervical cancer prevention, again, getting your annual exams and also screening based on your personal history for pap smears and talking to your provider about that. And then those annual pelvic exams are really important because they allow us to look and ensure that the tissue is healthy and normal on the outside and on the inside.
Now, before we wrap up, for those who may be concerned or like hesitant to go get tested or, you know, just a little bit scared, how invasive are these procedures? Are they major? Are they, you know, quick and easy, just for those who are considering whether or not to go get screened?
Yeah, that's always a concern that we get. And so I usually my goal is to empower patients to know their status, right? So know the last time you got your pap smear, just like you know the last time you got your mammogram or your colonoscopy. The examinations are not comfortable, and we very much understand that, but we do our best to walk each patient through the experience that they're having and make sure that they know what testing we're doing and what we're looking for. We really do take those visits as an opportunity to educate patients and prepare them for what's to come.